Rhinoplasty is quite a broad school or broad concept, and it really is a scale. You can start from something really quite simple, moving up to really quite a complex reconstruction, especially if that patient's already had a rhinoplasty before. But broadly speaking, you're talking about either a rhinoplasty, which is just looking at the nose, or a septorhinoplasty, which is looking at both the nose on the outside but also on the inside too. Generally speaking, when you're talking about a septorhinoplasty, you're talking about something functional. There's a problem with the breathing and the airflow. Lots of different symptoms there, as well as feeling like they're obstructed. You can get sinusitis type symptoms, a runny nose, lots of obstructive hay fever or cold-like symptoms. And that can be really quite debilitating. Similarly, it then becomes very pleasing when you can improve that, especially if you can do something aesthetic on the outside as well. You can have something very simple, a little adjustment to the tip, for example. That would be probably the quickest operation. But broadly speaking, in fact, I know this from looking at my own data, most people, the first thing they're thinking about is a hump. And so you're talking about a full open rhinoplasty there. You can have a closed rhinoplasty and open rhinoplasty. Broadly speaking, most of my rhinoplasties are done by an open approach. But in certain cases, if it's suitable, I will do it by closed, by which I mean there's no scar on the outside. I usually like to take an hour over my first consultation, which usually gives me enough time for me to get to know the patient and for them to get to know me. I really need to understand, get into their mind at what their vision for their rhinoplasty is going to be, and you can't do that in a quick consultation at all. We need to both understand what the patient wants, but I need to understand or be able to explain what I can offer too. Patients will often bring images that they like or that they found online of other people's noses. That can be helpful sometimes. Sometimes they're not necessarily realistic, and that can be a problem, but even bringing them and showing me something that I don't think achievable still has value, because I can explain that. I can say, I can see what it is you like, I'm not sure that's completely achievable, but this might be. We might be able to get halfway to this, or we might be able to get 3/4 of this result. If I've got an image and I don't think that's achievable, then I'll make that very clear to the patient. I certainly wouldn't give them any false expectation. Patients will often ask how long a rhinoplasty takes. The simplest rhinoplasties might be done in 90 minutes, but a standard rhinoplasty is more like about 2 hours. So moving on to the more complicated rhinoplasties, the septorhinoplasties, that's more like 2.5 to 3 hours, especially if you're having to use grafts, for example. Patients are also often interested in what the recovery process is going to be. I usually say that first week is the most difficult, because there's a splint on the outside. They can usually see some bruising around the eyes. They tend to feel quite snuffly, like they've got a cold. Surprisingly, it's not that painful. It's more like, as I say, feeling like they've got a cold or snuffly or a blocked nose. When the splint comes off, usually around 5 to 6 days, again, there's a lot of swelling at the tip, which can be quite hard to take, and so I wouldn't be advising anything important socially for those first 2 weeks after the rhinoplasty. But actually, by 2 weeks after the rhinoplasty, you could walk down the street and people probably wouldn't even realise you'd had anything done. The bruising will have gone and you're back to your kind of normal outward self. By 6 weeks, you'll be back to all your normal activities. Actually, I want people in the gym from 2 weeks if they want, not necessarily lifting weights, but they could certainly be on a bicycle and exercise bicycle in the gym. A lot of people will say it takes up to a year to see the final outcome from a rhinoplasty. That is true. If you're talking about the final stable outcome, all the swelling gone, no further movement, scars mature, it probably is a year. I do often get asked about, is rhinoplasty painful? And surprisingly it's not. We do always give some painkillers to go home with, but I'm always pleased to hear how they're rarely needed, especially after the first couple of days. Considering how much surgery is involved and how much swelling you see or bruising around the eyes, again, it's always very pleasing to hear that it's not especially painful. When we have the consultation, we'll have a thorough, in-depth chat about all the potential risks and complications of the rhinoplasty surgery. There's no such thing as no risks. But similarly, I wouldn't take on a procedure if I thought it was particularly risky or someone was particularly prone to getting a problem afterwards. Having said that, we've always got to be aware that there can be things that go wrong. Certainly in the early post-operative period, I always am very clear to explain the nose will be quite swollen. And there's often not much you can do for that other than use the cold packs and wait for the swelling to go down. Running with that at the same time is that you'll often feel quite stuffy and blocked up. And that could be quite debilitating, especially if you weren't expecting it. But again, that should usually settle down by itself. Especially if someone's had a septorplasty, we're often doing the operation to improve the airway. So again, even within just a few weeks, we'll often see improvements in the airflow. So that can be quite a pleasing, positive experience for them.